Now our next speaker is Nilanjana. She is the ARDSI National Coordinator Training and Secretary General of the Calcutta Chapter. She has a triple master's in Sociology, Human Services and Dementia Studies, a certificate in Successful Aging and End-of-Life Care from Stanford. She's an international master practitioner of Spark of Life, Philosophy from Dementia Care International, Australia, and of Dementia Care Skills from ADI. She's back to 26 years of experience that includes training in the US, after which she started her commitment in Kolkata in 1999 to successfully implement community awareness initiatives, home care, carer support groups, dementia training, a daycare center, rural dementia clinic, and a Bengali publication on dementia care. She's part of this consultative team of Dementia India report that was presented to the Government of India in 2010. Today, she coordinates a module of dementia training for professional care workers and an online module for physicians. Her mission is to improve the lives of persons with dementia and their families, and also to raise the standards of dementia care. So I give a hearty welcome to Nilanjana, and we have some more good things to hear.
Good morning, everyone. Thank you, Vidya, for that introduction. And of course, ARDSI National for giving me this opportunity to share the information and the experience that ARDSI Calcutta went through during this pandemic. And I'm sure it wasn't any different from the rest of the world. Give me a second before I start my presentation. I hope you can see my presentation. Great. So as COVID-19 invaded us this March, uncertainty of how we would function, that is how we would reach our clients, their families and people in general, was a major issue. The challenges were tough, no doubt, but as dementia artists, which is what we call ourselves, we are committed to imagination and innovation by nature. And we never throw away a chance to deal with setbacks. And that's what we do every day when we take care of the person living with dementia. So that's exactly what we did while dealing with COVID. It wasn't any different. Just a second. Okay. So before I go into how we dealt with the setback, a very brief information to share with those of you who are new to ARDSI Calcutta. This was born in 1999, and we have over the years designed and delivered services that includes daycare, home companionship, training of family and professional caregivers, memory clinics, caregiver support with counseling and education, and also publications on dementia available in English and Bengali. Our database shows that for the past 21 years, we have physically reached around 26,337 people, an average of about 1,250 per year with our programs and services. On this slide is a screenshot of programs and services extended 6 months before COVID, that is from September 19 to March 2020. You can see 38 awareness campaigns that reached around 1,200 people, 6 carer support meets, which is 1 each month, that reached about 16 family members, 6 clinics in Kolkata that saw 17 people, 15 clinics in Chandanagar, which is our outreach program, that saw about 64 people. Care plan was provided to 23 families via home visits, office visits. Daycare was extended to 9 clients per day on an average, and home companionship was provided to 12 clients per day. Now, here's a look at the number of programs and services extended since COVID. You can see it took us a couple of months, April and May, to understand what it is doing to our population, plan what we can do and how we can do it. Then from June, we decided it was time to help the person with dementia and their family caregivers to have the most normalcy in this most unnormal time. We wanted to help prevent isolation, not preserve it, even though that's exactly how it is designed to keep them safer from COVID infection. Our mode of delivery changed from traditional in-person model to virtual sessions. So programs like awareness building, client assessment, counseling caregivers, medical consultation, all of these went online. For home companionship, though it was tough without those warm hugs and touch, we had to go online. As you can see in the chart, from June till date, virtually we have conducted 28 awareness compared to 38 before COVID. Caregiver support was the most important task taken up by the staff, and we continue to call families to get updates on their well-being. Memory clinic in Chandanagar started to function in person since June, and the one in Kolkata is open online. Home assessment also went online from the month of June. Our experience past few months has shown that services like assessment is quite manageable to virtual evaluation. This is because cognitive assessment is strongly dependent on interview and questioning rather than direct physical examination. And our feedback shows that person with dementia and caregivers report similar satisfaction with virtual visits and in-person visits if done well. The daycare center is a lifeline, we all know, for members all around the world and their families. So with some relaxation since June, the center started to welcome its members back. A huge amount of thought, planning, and application has gone into it. Our plans have to be scrutinized by our panel of doctors every week and explained in great details to families so everyone can feel reassured. One of our clients' son, Vishwajit Ghosh, whose father is 96 and has been a regular at our center since 2015, he said when he heard that our daycare center opened, he said he breathes there. So for me, the opening is helping him to breathe again. New queries have also started to rise, but at the moment, it's just 2 clients compared to 9 per day on an average. Fear still prevails in the community, and rightly so. While the heart and humor of the center remains unchanged, there are many changes in how we operate to keep people safe. We have also kept ourselves flexible by offering the daycare service at home setting, just to make sure that we continue, thereby making sure that we were reaching our clients when and where they needed us. Our home companionship service, which is one of our most successful one financially, picked up both online and in person. Though the numbers are nothing to be happy about, still we believe the graph should look brighter soon. Now, to make all this possible, we went through 4 stages of planning and implementation from mid-March up until now. So let me share that part of the planning. In the first stage, which was the exploration phase, and that was immediately after lockdown, board members of the chapter met virtually to come up with a plan of action. And I, as the secretary, was directed to communicate the same to staff and volunteers, virtually, of course. Number 1 in the plan of action was gather data on the burning issue and help support families with information, like checklists of do's and don'ts of COVID, resources like phone numbers of local police station, community support clubs, COVID care hospitals. Also initiated conversations around care if their loved ones or they themselves contacted COVID. This, I believe, was an important step, as we did have a person who had COVID. And since the information was in place, the care could be extended smoothly. We also had few deaths at home during this period, and here too, not though due to COVID, natural death, but since contacts were already identified beforehand, the rituals and rites were performed without a hassle. Number 2 in the plan of action was we got in touch with our volunteer nurse who helped us deliver medications and conduct verbal wellness checks at home. This was possible even during the lockdown since they had free access to all areas. Another challenge we had to deal with is many caregivers contacted me saying that they were struggling to be accepted by their loved ones with dementia when they wore a mask. My simple suggestion to try was to wear a mask that made sense, that carried a special meaning to the person with dementia. As you can see here in this slide, there's a mask and it has a beautiful line from Tagore's song, and that one of our client loves. His caregiver painted the lines of the song and wore it. So this simple creation, what one does is whenever the person with dementia looked at it, he read his favorite line and had a smile on his face. Little changes, trying out different things to see what worked, what did not. In terms of medical consultation, we went virtual. It was offered as and when needed using our panel of doctors. Our helpline also went, of course, it was there. So it was one of the most successful work that the staff did. And we reached caregivers with reasonable plan of action for care at home and ways to sustain social interaction. I think that was missing. Another step I took as a secretary was to utilize my network to fundraise so we could continue supporting staff salary, their travel expenses in private transport, additional infrastructure expenses like technology, cleaning, etc. The fund raised in March continues to help us until the end of November. The World Alzheimer's Month also gave us yet another opportunity to reach people with message of support. Last week, in fact, we had Innerville Club donate 6 months of cleaning and maintenance items to us. Another individual will support our online programs for next 1 year. So such efforts we hope to continue. Then came the initial implementation phase. By now, we could sense the isolation created by this pandemic was a killer. People living with dementia and the caregivers don't deserve to be left alone. That is what we decided. We need to be careful, yes, but also be thoughtful and kind. Our first decision in this regard was to invite the so-called bored and stressed children from various schools, not only in India, but also abroad, perform, record, and send us. We shared those videos with families to provide entertainment for the person with dementia as well as for the family members themselves. Here on the slide, you can see young Tural from Mumbai with his mandolin. And it was wonderfully received by all the family members and the person with dementia. They just thoroughly enjoyed each and every children's performance. Next, we immediately decided to do an in-depth COVID survey of the needs of caregivers. We used our telephone to understand how we could further extend practical help. We collected huge data that reported we needed to go online with our services, like engagement, especially with the person with dementia, and counseling and helping family members to manage the challenges at home. So several webinars were conducted for family members on topics that were the need of the hour, like communicating, meaningful activities, helping with ADLs. We plan to continue these online education as caregivers' feedback has been very positive. When it came to professional staff, it was a challenge to keep them mentally engaged and motivated. Though they were getting paid, these were people for whom caring was a matter of emotional survival. So during the 2 lull months, April and May, I kept them engaged by asking them to build on care resources for future use. And also started training them not just in using technology, but also making their video or audio calls meaningful. A manual was prepared and shared with family that included the do's and don'ts to be maintained during the online calls, like choosing a room that was relatively quieter than the rest of the house, a comfortable sitting arrangement, the visual platform well placed and in eye level, finger foods available on the side table, good sound system. It was also demonstrated to the staff how they can try meaningful approaches, keeping in mind the life story of the person when starting a call. Say, for example, the person I'm calling loves the songs of Asha Bhosle and connects instantly with her music from the 60s, anytime, any day. This vital information can help us start the call. So as soon as the video is on, the caregiver with a smile on the face would say, "Aao huzur tumko sitaron mein le chalu." The chances for that person to stay tuned to my next move is higher than if I said, "So how are you, sir, today? Am I audible? Can you hear me? The day looks bright," right? So any verbal introduction makes it difficult for the person with dementia. So anything that makes the person, engage is what we need to try in the calls. More ideas that was shared was asking staff to sort interesting objects, pictures found around their own house, and turn the wall behind them from where they made the calls into an interesting visual by hanging those things. You see, dementia narrows the vision of for a person with dementia. So taking advantage of the limited space in the background and calling attention to visuals could be an engaging reminiscence activity. I also started training them how to extend in-person care because we were soon planning to start that. So here topics of sanitizing the center, themselves, also learning how to speak with eyes because mask would cover the rest of the face. That was so very important. Another crucial learning was how to be on the side of the person rather than in front of the person while providing care. This was to minimize infection. This particular approach can be helpful any time of the day. And the reason is, as I turn my body sideways, the benefit is twofold. It gives the care recipient the chance to see beyond me and also make them realize that I'm not blocking them. So people with dementia, do not like others interfering with their intimate space. Very much like us. So also included in the training was learning to use clues or signals in communicating to provide care. Basically use distance to get information and thereby avoiding spread of infection. In other times, we physically lean in front of the person to ask their preferences. With COVID scare, better if we did that from a distance, and then came closure just once to deliver their needs. So all staff went through weeks of these training by mock handling and role plays. This training was extremely important for care staff to understand that safety measures were solely their responsibility and that they should not expect the person with dementia to follow any COVID rules. I believe very much that many health officials have forgotten about the challenges of people living with dementia when giving the guidelines. It's impossible to follow those without causing potentially irreparable harm to the relationship between the person with dementia and the caregivers. The guidelines to me personally are simply not logical, reasonable, or achievable. The only thing possible is for caregivers to be vigilant, disciplined, and use common sense every moment. At this stage, we were ready to implement the in-person work at the center, our day center, with limited numbers, as you can see in the middle of the slide. Just 2 of them. The service provided at the home setting can be seen on the right-hand side of the slide. Our caregiver with the person with dementia and her granddaughter out for a walk to get fresh air. On the left is our memory clinic at Chandanagar, which started to function with our doctor volunteers who takes very special care to follow the protocols. COVID-19 is not only about gloom for us, frankly. As an organization, it has brought a positive transition from an only in-person reach out to virtual platforms that has provided amazing opportunities for expanded outreach and new community collaborations. We have reached far greater number of people from far off places with ease and without much spending financially or physically. So we have decided to keep ourselves available online with or without COVID in days to come. It is my big hope that dementia care will surface from this crisis with a much improved sense of relief. Yes, it has taken a tragedy to show us what can be achieved, but there is so much more we can do to improve the lives of people with dementia and their caregivers. On this slide, in the middle, you can see some boxes. These boxes are memory boxes, and they are made by a volunteer recently and contains various items that have special meaning and value for a person living with dementia, all of which can be used to transport him or her back through to time to their happiest moments. The items could be family photos, a letter with special sentimental value, awards, personal honors, vacation, postcards. The list can be endless. We are eagerly waiting for it to be explored. Friends, statistic from last night, I checked last night, tells us that there are 91,149 deaths due to COVID in India from past 6 months. I also checked the deaths that occur due to dementia everywhere in India, every year in India. It is 9 lakhs per year. It is 9 lakhs per year due to dementia compared to 91,149 in 6 months. Unfortunately, the deaths due to dementia every year goes unnoticed or without any interventions. So I think it's time for us to wake up and do what we need to do. Give care with care until there is a cure for COVID. Thank you so much.